If your sadness looks like anger, you might be a man. Men often express their emotional pain through anger and irritability, which can be confusing for both themselves and those around them. This is because societal norms often discourage men from showing vulnerability or sadness, pushing them to express their feelings in more acceptable ways like anger. If your anger looks like sadness, you might be a woman. Women, on the other hand, are generally more in touch with their emotions and are more likely to express their feelings of sadness and despair openly. This can sometimes make it easier for them to be diagnosed with depression, but it doesn't make their experience any less challenging. Let's talk depression. Depression affects both men and women, but it doesn't always look the same. The symptoms can vary widely between genders, influenced by a mix of biological, psychological, and social factors. Understanding these differences is crucial for providing effective support and treatment. Women are nearly twice as likely to be diagnosed with depression. This higher rate of diagnosis can be attributed to several factors, including hormonal fluctuations, greater willingness to seek help, and societal acceptance of women expressing their emotions. They often experience emotional symptoms like persistent sadness, guilt, and anxiety. These feelings can be overwhelming and can interfere with daily life, making it difficult to maintain relationships, work, and even take care of oneself. On the other hand, men might show depression through irritability, anger, or risky behaviors, like substance use. These behaviors can be a way of coping with their emotional pain, but they can also lead to additional problems such as addiction or strained relationships. They're less likely to recognize these signs as depression, often due to societal pressures to tough it out. This can prevent them from seeking the help they need, leading to prolonged suffering and potentially worsening their condition. Hormonal differences play a role too. Hormones can significantly impact mood and emotional well-being, and these effects can differ between men and women. In women, hormonal changes related to menstruation, pregnancy, and menopause can increase the risk of depression. These periods of hormonal fluctuation can lead to mood swings, irritability, and other symptoms that can contribute to the development of depression. Men, though affected by hormonal shifts like low testosterone, don't see the same direct impact. However, low testosterone can still contribute to feelings of fatigue, irritability, and depression, but these symptoms are often overlooked or attributed to other causes. Cultural factors also matter. The way society views and treats emotional expression can greatly influence how men and women experience and cope with depression. Women are generally more open about their emotions, while men tend to bottle things up, which can make it harder for them to seek help. This cultural expectation for men to be stoic and self-reliant can prevent them from reaching out for support when they need it most. When it comes to treatment, women are more likely to seek help and stick to therapy. They often benefit from talking about their feelings and working through their issues with a professional, while men often prefer medication but may struggle with adherence. This preference for medication over therapy can be due to the stigma around discussing emotions and the belief that they should be able to handle their problems on their own. Understanding these differences is key to better diagnosis and treatment, ensuring everyone gets the support they need. By recognizing the unique ways depression manifests in men and women, healthcare providers can tailor their approaches to better meet the needs of each individual. Remember, depression doesn't discriminate, and neither should we. It's important to approach mental health with empathy and understanding regardless of gender. If you or someone you know is struggling, reach out for help. There are many resources available, from hotlines and support groups to therapists and counselors. Let's make mental health a priority for everyone. By raising awareness and reducing stigma, we can create a society where everyone feels comfortable seeking the help they need.